Wellness Wednesday. Our health experts return now to answer your specific health and wellness questions. So again, here are Dr. Scott Van Apeldoorn from Evergreen Health and nutritionist Susan Jones. Thanks for sticking around with us. Dr. Scott, so what else does a prostate, may I call you by your first name?
Absolutely, please.
What does a prostate screening involve other than the blood test? What else do you do?
So really two things, the blood test, as we mentioned, and a digital rectal exam, which is just the doctor feeling the prostate gland. So about 5% of the time we can pick up cancers from the prostate, the way it feels, that don't produce a high level of PSA. So we recommend both.
And how often should somebody be tested?
So that's really a debatable thing. The guidelines change commonly. Nowadays, the American Urologic Association would say men between age 55 and 69 should have the discussion with their doctor, the pros and cons, etc. Men at higher risk, the ones we talked about with family history, African American men, certain exposures, have that discussion earlier in life. And really, people with low PSAs in that 55 to 69 range, we're saying even check it every other year. You don't have to do it all the time to try to limit the harm in over-detection, etc.
Right. In terms of catching this early, is it like other cancers that the earlier you catch it, you're really at an advantage?
And that's absolutely true. And that's really the whole crux of the argument is, you know, prostate cancer still potentially is a deadly cancer, and the earlier you find it, the better your chance of cure. For example, if the cancer is localized to the prostate gland, the chance of cure, the 10-year survival rates are very, very high. If the cancer has spread outside of the prostate, the chance of survival 5 and 10 years down the road is very, very small. So that's the whole crux of the argument.
Right. Just catch it and treat it and hopefully go on with your life. Susan, what if cancer is not somebody's only medical issue? If they're using your cookbook and trying to figure out what to eat, what kinds of things should we be aware of?
Well, one of the things that we felt were really important was including the nutrition facts on each label, so that if people have heart disease or if people have diabetes, they can look at those facts and think about that food the way they would look at other food and decide that it was good. We know that it's good for the phase of cancer treatment they're going through and their side effects that they're having, and then if it also is helpful to the other condition that they're thinking about.
How would you suggest we go about food as a preventative measure? If we're trying to lower our risk of cancer or lower our risk of diabetes, are there particular foods we should be incorporating?
Well, I think there's two ways to look at it. One is what we should be incorporating. For sure, more fruits and vegetables, that's clear. And perhaps less use of red meat. If you're going to do red meat, a lot of people now are eating grass-fed meat, which has less saturated fat in it and is more healthful. I think that it's difficult to think that just what you eat is going to help you necessarily prevent getting cancer, because there's so many different risk factors involved. But definitely it can help you decrease the risk of getting cancer. One of the things I recommend is that people try to buy organic milk if they can, because we see a lot of young girls getting a lot of hormones in the food, particularly if they drink a lot of milk, eat a lot of yogurt, that kind of thing. So if people are on a budget, they feel they can't buy everything organic, which is very understandable, choose those foods carefully and look out for extra hormones, extra antibiotics.
That's really important for people who have young children now. Making that choice would maybe be a really good one. Also, what sorts of treatment are available for prostate cancer? What's your menu?
Well,
get that positive test.
That's one of the nice things with prostate cancer treatment. There is a menu, and things like surgery to remove the prostate gland. There are various forms of radiation therapy, brachytherapy, seed implantation, cryotherapy, freezing the prostate.
Go back. Seed implantation. What is that?
So radioactive pellets are inserted into the prostate gland, and it's a
wow, that sounds like no fun.
Well, it sounds that way, but it's quite an easy treatment to tolerate and to administer. And so there are a variety of pros and cons of all these treatments, and usually one size doesn't fit all, and we tailor the right treatment for the right patient.
So that involves your history, what stage of cancer, your overall health. I
your
imagine,
health and
all
your
that
age
stuff.
and patient desires, what's most important to them. There are just so many things that go into it. We can't just say, you have surgery, sir. It just doesn't work that way. And that's, again, one of the nice things. There's a treatment for everyone.
Good. Food allergies, Susan, what would you say?
Well, a lot of people do have food allergies or feel diminished in their health when they eat certain foods. They may not have scientific allergies, but they have reactions. And that's one of the things about the cookbook. It's all hypoallergenic, so it doesn't have any dairy, it doesn't have any gluten, it doesn't have any processed sugar, and it doesn't have any soy, because there's so much controversy around soy. We just didn't want to get into that.
Okay.
So, and then if people don't have food allergies, then they can just substitute what they normally have. But it gives people an option that if they do feel that they're sensitive to some of these things, this gives them a wide range. We use a lot of different kinds of flours, a lot of different kinds of sweeteners. Right. So there's variety is very good, and people should realize that in general. You don't have to be
in life,
sick.
it is.
Exactly.
Thank you. And there's so much to learn from this book. I'm excited about kind of going through it, cooking from it. Thank you both very much. Appreciate it. When we come back, how to manage the chaos and stress that the holidays can sometimes bring. Our holiday life coach is going to give us some tips up next.